Okay, so my name is Shaneel Pathak. Welcome. This is our first webinar, and it's going to narrate the story about the power of data in your hands. And it's really some real life examples of what we've done, being a caregiver for my wife, and not focusing on the journey, but mostly focusing on how we had our data and how it influences us, and the whole. What I'd like you to I like you to take away from this webinar is the value of data, and how it actually influences your health decisions. Maybe not right away, but it could be in the future. And so then we'll go into a bit about how do you collect that data and how we used it in those examples. I like to make this interactive, and Ukash, who's going to be our moderator, he's with the team, and he could moderate any questions. By all means, during the presentation, please raise your hand, and we're happy to discuss any questions. Okay. So one thing I'd like to talk a bit about is the mission at ZoeInsights. Um, the whole goal of ZoeInsights is we're a social enterprise, and we want to connect you to your data, to resources, community, to live your best possible life, to live an optimal life, no matter if you're going through a medical condition, or not. It's all about living the best you can. And so, as I mentioned, my story started in 2012 when my wife started getting shoulder pain. And during that shoulder pain, we went to the doctor, and she was dismissed. Twice she was dismissed, and they thought it was just basically muscular, to go to RMT. But as the year went by, her pain got much worse. We concluded that it couldn't be muscular, and so then we were fortunate. We did a private MRI, and we did the MRI, and then that's when it found out that she had something suspicious in the lungs, and it turned out to be lung cancer. And my wife was a non-smoker. She was a runner, and we caught us from surprise. And unfortunately, when she was diagnosed, she was stage 4 at that time. And so that changed my journey as being a management consultant, to becoming an advocate for health data and also for people's health. And since that diagnosis, I've been more engaged in a lot of patient advocacy. I'm a part of the Patient and Family Advocacy Network. I've given talks at various conferences, mainly around data, but also around patients, the processes that patients have to go through, and the challenges that we go through in the system, and how do we improve the system. So my last conference I attended was in November, where I presented something similar to this in terms of the power of data in your hands, and that was at the Imagine conference in Calgary. And in parallel to that, we started off, we as in Corey and myself, decided to look at ways of using digital technology to help us guide us through this. And so with the partnership of Alberta Cancer Foundation, we created ZoeInsights. We have a team of 10, including Mike, who's on the call, and also Ukash. We have Wendy and a few others. And together, we all have the same mission, is to help people with their health journey. And our contribution is from giving you data that's meaningful and actionable. So when my wife was diagnosed, she was told she has months to live. And it's very hard when she was 36, so she was diagnosed, and then also given that prognosis, but she lived about 5 years. Less than 2% did. And the way we did that, and this is where oncologists and other patients were inquiring, like, well, what did you do? And so what we were fortunate to do is we were able to take her data, and she would start graphing this information and start analyzing it. And with that, she was able to understand her side effects and her symptoms, and how to change these levers in terms of the medications to make sure that she could live the most optimal life. It also allowed us to ask the right questions. It also allowed us to weave from our system here in Canada, and sometimes we had to go to the States in terms of getting tests done. And we were able to define that out because we found a community and a network. And with that network, we were able to get direction of where to go. And I'll tell you a bit about that story, because we were then able to make decisions based on real world data from people, and even before it was standard of care. And so that's kind of what our purpose is take what outliers are doing and make it the standard of tomorrow. And so a lot of lessons learned, not just from what we were going through, but other patients and caregivers in terms of cancer. We applied that and to help us. Now, the story I'm going to be talking about is not just for cancer. It could be for anything, any chronic disease. But lung cancer is used as a reference just because of personal experience. Yeah. So when it comes to data in your hands, typically this is how it looks like. You have a notebook, you have a binder of all your information. We started collecting CDs of all the MRIs and diagnostic imaging. And we could collected all this information because then we could disseminate it and distribute to whomever we feel important. So I was fortunate we had a family member who was a physician, and so they would get our MRI reports. And the reason is because we wanted further detail, further understanding of what do those terminologies mean, and we were able to have that conversation with our family and friends at our own time, in our own space at home, to really think through it and understand it. And that helped us a lot, not necessarily changing clinical decisions, but when you have your own data and you can start reading it and learning about it, it gives you peace of mind because you know what to expect. That fear that you might have could be reduced. And so collecting all your paper documents is important. And now we have portals in Alberta and some places across the country, but they're not always complete. And so it is always good to get in the practice of start collecting your information. And the rebuttal is people say, well, my doctor has it. Why do I need it? So yes, your doctor has it. But if you move physicians or if you move cities, then you break that continuity of care and you break that data. And that's the hardest part is 5 years down the road, when you look back and your doctor asks, well, tell me your history, you don't have it. And so getting that practice of collecting your information and filing it is always a good practice. And I want to highlight here this graph. And so what do you do with the data to make it meaningful, right? I mean, the binders are a start, but what we did is we took our blood work and we learned what the doctor was looking at in terms of blood work, and just ask them, what are you looking at in the blood work? And they will, an engaged patient is something that I think doctors always look for and will make space and time for. And so they told us about the tumor marker CEA. It's a blood test, and we would be having that. We would doing that every month. And the tumor test was a way to show the intensity and of tumors and then progression. So there's a loose correlation with progression. But what we were able to do is map this out. And then as you can see here in the red circle is that there was an uptick. So we presented this graph to the doctor, which he found it very valuable because the oncologist says, like, we have the numbers, but it's the longitudinal data which is important. And that uptick gave us suspicions that it was progression. Enough so that he moved the CT scan forward. We had the CT scan and we confirmed there's progression. And that progression was found before symptoms started. So rather than taking a reactive approach, we took a proactive approach. And that gave us more time to find the next line of therapy. And also making that decision wasn't done in haste. It wasn't done with an aura of worry. it was done with time. So we started graphing certain markers, and that all came from being able to provide information to your care team so they could guide you in making the right decisions. Now, the future will eventually look like this, not the apple, that's just symbolic. But we're at an inflection point where all our health data is becoming digitized. And that includes not just stuff in the electronic medical record system in the hospitals, but also all your wearables. You could go and get tests done, right? You have direct consumer testing, and we use that. And so all this data is coming, but the question is, where is this data? Where to put this data? Sorry, I think we just got a notice here about sound check. So I'm going to do a sound check. Can people hear me? Can people hear me clearly?
Yeah, you're good.
I'm good? Okay. Okay, so hopefully John could, hopefully his volume could be higher. Just for people, there could be two volumes, one on the computer and then another one on your headset if you're using it. So this, I think we're at an inflection point because people are becoming more aware of the health data that's available. They have access to it, and this could influence the care you receive. Because now you don't only have to go to your primary care facility, let's say Alberta Health Services, you can go elsewhere to get the data that you need and the tests that you need. And so this obviously is moving towards patient empowerment, people empowerment. And one thing I want to talk about, this is kind of, I tried to mock up the journey of a person in terms of empowerment and when it comes to data. And the theory is, at first, when you're going through a health journey, you want to fill the gap in knowledge. Right? That gap in knowledge is you want to understand not only your diagnosis or your injury, you want to understand what other people are having. You want to understand if it's a condition, more about that condition. So you want to fill that gap in knowledge. And that's what this webinar is about, is filling the gap in knowledge. And the next webinar will be more of how do you take that knowledge and make it actionable and making decisions out of it, and how do you involve the community in that decision-making process. And then you get third tier is the outliers. So those outliers, and I would say my wife was an outlier because we found a group of people around the world who we were consulting with, who actually had certain medication before Canada did, so we could understand what they're doing. And then these same outliers would be going to medical conferences. And that's one thing which has changed quite a bit, is the access to information. So it's basically the democratization of information, and that's the internet has done. Just like we have people here from not just Alberta, but across the country, and we could in real time have a conversation. And so at these medical conferences, they allow patients to come in. I've attended them. They welcome people, not just patients, but caregivers, people. And you could get in obviously at a discounted rate and have a conversation. There's actually a lot of the lung cancer conference I went to had their own stream of talks focused on patient empowerment and patient engagement. And we find that that's quite common. Now, one thing to notice is as you move up and progress to become an outlier, your knowledge increases, but you'll see that the privacy decreases because people are sharing their own data. And be cautious, because that's when, as you take decisions in your own hands, there's obviously that element of risk, but they go hand in hand with health knowledge. Right? But what I want to mention is about privacy, is because I think health trumps privacy. If you're healthy, privacy is at a very high level. But if you have a issue in your health and you want to get the result, you realize that that takes precedence of privacy. I think the philosophy is it's not about private or not being private or public. It's having control, right? If I have control of my data, I should be able to distribute to whomever I want when I want, right? And that's control. What I feel that in the healthcare system, they want to lock that data down because of fear of it being getting into the wrong hands, and that's justified. But when it's in your hands, you want to be able to disseminate to whomever you want, and that's what I found the outliers were doing. So, what's a drive to acquire data? From our experience, there are 4 attributes. One is you want to trust the information you receive. And that could be from your care team. One individual told me is she trusts but verifies, and I'll go into why you want to verify. You want an understanding of the care process of the disease, and you also want to have an understanding of if the care process that you have been treated with, no matter if you're in Toronto or Calgary, is identical or could be better in another city, and if so, why aren't you getting treated that way? And then data gives you a sense of control. There's a quote from Napoleon Hill. He's an author from the 1930s. He says, knowledge becomes power only if it's organized and directed. I paraphrased it. But it's about taking your knowledge and organizing it such that it becomes meaningful for you or the care team and that decisions can be made. Hence why graphing your information takes that same information, but it becomes organized in a fashion that could be executed on. And your will to live is in hand with your pursuit of knowledge. In terms of the many people, especially with the information around the internet, people are hungry for information to help them and make them better, or it could be their caregivers. And so I think the challenge is that there's a lot of people who want to gain knowledge. The question is, how do you gain that knowledge? Because the open internet, there's so much information out there. What is valid, what is not? And I'll kind of go into that as well in terms of how do you validate good information. That all starts with collecting your own data and understanding certain terminology. But I want to end with this slide with some interesting facts. Oops. Oh, I clicked on that already. But the key thing here is when it comes to information, medical information is doubling every 72 days. Right? This is why the concept of trust or verify. It's really not about suspicion. It's about understanding that are you getting the best care? Every 72 days. In 1984, when the Canadian Healthcare Act came about, and that's what structured our healthcare system, it was every 7 years. And in 1950s, it was every 50 years. And so it was okay going in 1950s, going to your physician and trusting them that they have all the information made sense. Today, it's virtually impossible that one individual can understand and learn what's happening with a certain disease or medical condition just because of the amount of information. So it's a far more complex world. But I want to give you an example of what you could do with your data and other people's data. And this is what outliers are doing. And this is, it was a article that was published in a journal. This is from myself and Christina Sitt from Lung Cancer Canada. And it talks about a time when my wife was given, she was given a lung cancer drug, the latest one that was approved, but she also had brain metastasis. And the question is, we had to make a choice between whole brain radiation or going on this drug. The oncologist said whole brain radiation because there's no data that they had. And so but we weren't ready. We weren't ready for that path. And so what we did is we went to the group of outliers in our community and we said, can you please give us your data? The people who are on this drug, on the clinical trial for this drug, can you please give us our data, because we have to make a decision. And so we had about 66 people who had the exact same profile as my wife, and they gave us their brain MRIs. They gave us their data, and we were going through it. And just statistically, we found that most people had a response to brain metastasis using this drug. So we summarized it, we analyzed and summarized it, and told our oncologist the story. He said, this is your decision. You know the risks, but at least we were informed. At least we had the data to make us comfortable. What I find is sometimes in our system, empowerment from the system means giving the decision-making power to the patient or the family. That's not empowerment. Knowledge in a certain format plus the decision-making ability is empowerment. And so what we did here is we decided to forego whole brain radiation, but we promised, the oncologist insisted doing the MRI within a month. My wife started taking the medication. Within 2 weeks, she found a response to it. She was feeling better. And within a month, we did the MRI and she had a complete response to those brain mets. And within 2 months, we were in Bali. We went on a trip because she was cleared to fly. So that's the power of data in your hands and the collection of the community influencing your decision-making abilities. And so we wrote a poster, and this was presented at the World Conference on lung cancer. Now, this is not new. This gentleman, Dave, also had kidney cancer, stage 4. This was in 2007, and he was told that there's no other options. And what he did then was he went online and found a medical treatment based on what others were doing. Now he lives with, he's Ned, he has no evidence of disease. And the one thing that resonates with me, what he said is, one is give healthcare data directly to patients and people, and let people help heal healthcare, right? So we could influence the system by becoming more knowledgeable and pushing the system in a certain direction that helps us. So it becomes more centric to the people. So let's start with collecting your own data. How do you collect your own data? And how do you get in the habit of collecting data? And that's what I'm hoping as a takeaway, you appreciate the benefits of collecting your own data. The question is, how do you collect it? Sometimes it's not that easy. I'm actually I'm chairing a data working group for a group of patient organizations, and we're coming up with a declaration for people on our rights to our data. Just some history, the Supreme Court, this happened about 10 years ago, has said that health practitioners and organizations cannot withhold our data, that we have the rights to it, but that doesn't make it easier. And so I'll give an example of Alberta, but I think the philosophy could be applied anywhere in the world. In Alberta, we have My Health Records. We could pull the data. And the reason I say pull that data and keep it on your own computer is because if you move, you're not going to have access to it. And the other thing is with My Health Records is it's not complete. So often we get, it's promoted as if it's, it's promoted as if what to, I'm just reading the chat session here and I'll answer a few questions. It's promoted as a place to collect your own data. The thing is, our whole system is fragmented, not just in Alberta, other places. And so the portal that is provided to you is only portal for data that is from a hospital system. It's not from your GP, or it's not from your pharmacist. So for example, your vaccine records, log on to My Health Records, and it's not there for me because I didn't do it at a hospital. I did it at a pharmacist. So they don't have the record of it. Hence why it's important that you start collecting your own information. Um, so one of the key things here is when you go to your doctor, ask them for a copy of your information before you meet the physician, right? Ask the front desk staff. And so they prepare it, they have an expectation, they can get confirmation from the doctor. And so it's just more streamlined. So when you after the appointment, you could just pick it up and walk out the door. And so we used to do that and always ask that information. Now, the question is posed is what to collect. And this is kind of what these two slides are about, is you want to collect your lab results, your imaging. It could be any referrals that you have. You probably won't get, and you probably don't need, is your GP's medical notes, the doctor's medical notes. They're quite sensitive of giving those because from a lawsuit perspective. But what I found when we wanted a second opinion, other doctors don't read those medical notes. What they want is this. They want the labs, the imaging. Um, those are the two key things. Any test, any pathology tests. So that's the data that you should be collecting, because that's the data that often is asked for in terms of a second opinion. In terms of imaging, usually hospitals like here in Calgary, the best place to get your imaging data is at Foothills. It's a library. They have access to all your imaging across Alberta. It's a one-stop shop. You go there, and for us, we just made a call, and basically within a few hours, if not the next day, the CD is cut for you. It's free if you ask for a second. If you tell them that it's for a second opinion. So you learn these tricks, because if you just ask for your CD of your image, they think you just want it for fun, and they'll charge you typically $25. We legitimately asked it for a second opinion. We would upload it and send it to my family member who's a physician, and to me that was a second opinion. But the way of getting it for free and expedited is to tell them that it's for a second opinion and that you need to have you need that, or you need to request that. My GP offers electronic transmission of all our health data through email. And that's because I signed a waiver saying, yes, I know the risk of using my Gmail account. I'm okay with it. That relieves him from his duties. And now for $25, I get all my records sent to me after my appointments. I don't have to ask for it. It's just done. We're fortunate that my GP does that, but that's something you could ask them is to email it and ask for that consent.
Yeah, and I just want to give everyone the opportunity, like if you have, a question that is kind of specific, or you want to know what to collect, specifically, feel free to unmute yourself. Like we want to keep it more interactive after this point. And just to add to what Shaneel said, because it's so important that he says that, it's your right to collect your data, because when my wife and I had gone for just a regular checkup, we weren't given the initial option wasn't to actually get our lab results back. Yeah. And so when we asked for it, they were like, it was as simple as they just had to create another copy of it and give it to us. It was like a printout of our lab results. But I think collecting all of it and just keeping it is just good practice, because just a couple of weeks back, we had a need, like the nutritionist wanted to look at my wife's record. So, I mean, it comes in handy. So I just wanted to add to that point, and thanks so much for asking the question.
Thank you, Akash. And and that's actually on my next slide is the value of collecting your data. And thanks, Akash, to narrate that story, because it's the other practitioners who are looking for your data to help you. And I'm going to finish off this slide with talking about, I mean, your whole health record. You could go to your department and get that. ER discharge, important. Why? It's surprising, but what I found, GPs and on my oncologist wouldn't go to the system to ask and to research what you're there for the ER. They ask you. And so having this with you, you could narrate in an accurate format. The last one, and this is going to be a handout, I'll send it out to, is these two slides are a handout, but it's a consent form. Now, this is a consent form from Alberta, but every province or every authority has a consent form. What we did is we signed the consent form. So my wife signed it such that I have the rights to collect the information. We made it indefinite, and I had that as a digital copy with me as a PDF. And so whenever I had to get that information, I didn't have to hassle with it. I just had it a record. So that made it much easier. Yeah. So I'm going to go to the next slide, and I'm going to answer a question from John. So the value of collecting your own data. So Ukash mentioned about nutritionist, right? What it does is that allows you, we talked about reviewing your own data in your own time and space, right? With your own care team and care providers, providing to other practitioners. I'll give a quick example here. This is a paper copy of a requisition, and requisitions are only paper, right? They're not in the system. So when we went to the ER, we had to get blood work done at the ER. We showed them, we asked them to do the blood work for the oncologist, which happened the next day. They said they couldn't do it because they don't have the requisition. I pulled this up on the phone. He sees it, he legitimizes it because he looks at it, he knows it's legit. And then he, the ER physician did the requisition and did the blood work for us. How that benefited us is one, saves us time. It saved me time with driving to the labs and saved my wife another poke. So I'm going to pause there and listen to some of these questions here. So the first one is about signing up for my chart. Oh, so it's actually the gentleman talks about my chart and about access to all the information, including the doctor's summary notes and the first time that he had access to it. So more and more, our health system is getting into patient portals. The thing to think about with patient portals is in Alberta, you have 2 patient portals because you have 2 different systems, Alberta Health and AHS, and they don't talk to each other. In Ontario, there's 80. So if you cross Toronto or Southern Ontario, most likely you're not going to get that data, which may mean then if you go to the ER in Hamilton, but you're from Whitby, most likely they might not have that data either. It's just the nature of our healthcare system. So this is why it's good to get in your own practice, but a very good start is the fact that these systems are liberating your own data and making it easy to collect. And the other question is about, can you get a copy of your ER discharge after the fact? Yes, you can. I think the way you do that is you go to the health records department that ER is associated with, the hospital associated with, and then you could collect it from there. And you should have access to it. But it is your data and it's in a system. The hard part is finding which system, who has ownership of that system, who can provide you that data. But you will be able to have access to it.
Yeah, absolutely. And just to answer Rose, a little bit from my own AHS experience is that, when the discharge summary is being written and, the nurse is sort of giving you a sort of a follow-up conversation at that point, if you insist and ask for it, it can be given at that time. I think that's, if there's a caregiver involved, that's actually probably the best time because they have access to it. They can print it out and give it to you right away. But if it's after the fact, then, I guess that's what Shaneel said, is that the medical records department will have access to it. And I think it's, it's connected through with the health insurance number.
Yeah. So I want to, thank you, Akash. I want to move now in terms of once you have your data, what is the benefit? Or we talked about the benefit for you, for individual, but it's also going to talk a bit about going online and searching a community or searching information in your disease and linking that to the benefits of having your own data. And so often what happens is the hospital system, sorry for there being a fuzzy photo, but It's basically gives you booklets of paper. Our whole system runs through verbal or paper. And especially if you get diagnosed with a chronic disease or cancer, there's a lot of pamphlets, valuable information, but it's not portable. And so people do have a tendency to go online to get information. And this is what I was talking about, how it's to increase your understanding of your journey and influence the level of service. The questions you ask influence the care you receive. Right? And so in order to get to ask the right questions, people are going online to find people who have a similar journey. They're finding real stories. They're looking for real stories to help them be supported. It support them and mentor them through this journey. Because like a lot of the things with chronic disease is there's a mental stress of it, and it's also the physical challenge. And so you want to reduce the fear of the unknown. And so you go online to find a community. You go online to find more information of your disease. It's not always easy to find the right information. But in order to get and understand your right information, you first have to understand yourself. So this is a personal example. We learned what does this mean? Like, this is her diagnosis, my wife's diagnosis. This is the therapy she's on. And understanding your diagnosis as well as your therapy is important, is to validate and double check the information online. So I mentioned about trust and verify. Here's an example where we went to a website that had a lot of blogs on lung cancer. And you'll see this, you can Google your disease and blogs, and you'll find people talking about their experience. And how do you validate that this is legitimate? One is they talk about, as I mentioned, the diagnosis, and you'll see the patterns. The diagnosis should be very similar to yours in terms of in the treatment patterns. The other thing you can see here, you can eliminate, this is ROS1 mutation. And you saw before, my wife was an EGFR mutation, which is a particular type of mutation for cancer. So I wasn't so interested in the dude is a dad blog site, just because the person had was a slightly different path than my wife. So you could easily help getting your information, understanding your disease profile, your medical profile, helps you validate the information online. Another way is you'll see this blogger having an award for the best blog site. If I went to this award, I'll probably see a roster of other people. I'm going to go a little bit faster, but Inspire, great website to collect and understand information and connect to a community of people. It's very general, but they go to, let's say, the medical condition, but then after that, it's not as specific. But the key thing here is you could go in here and talk about, I'm on this certain medication and I want to learn about side effects. And there's been a lot of discussions amongst it. So it is global. There's about, people from 180 countries, and they have various topics, not just cancer, but a lot of the chronic disease. And how do you validate that the person is legitimate and actually aligned to what your story is often they put their entire profile up. And this is where I was saying that health trumps privacy. And so you could tell by their treatments and their diagnosis, is this a proper sequence? And if you could compare it to your own journey and see some similarities, it helps. Hence why having your data is important. And this person, it started 2015 and when diagnosed, but you want that longitudinal data. And that's why it's important to start collecting your data from right now and then moving forward. So a bit about, this is almost the last slide, but the advantage and disadvantage of filling your knowledge gap with online resources. So we talked about the advantages of finding a community of like-minded people, getting different perspective. How I look at it, when you connect with people that are not in your same country, the benefit is you get access to a knowledge of what they're doing in their country in terms of what their health center is doing. Because every country has a different toolbox. for your medical condition, and they approach it slightly different. An example here would be at Tom Baker for brain metastasis, it was CT scans in my wife's profile. CT scans was a standard, but we knew in Germany, MRIs, and also the States, MRIs was a standard of care. Proactively every 2 months doing MRIs. And we asked for that. And their pushback was, well, it's more expensive. That's why we do CT scans and we wait till you see symptoms and then we verify. It's like, no, you're not going to do this a reactive approach. Her quality of life will suffer if we can't make sure that her brain is clean. And so we were confident to ask the questions. We had the material to back it up, and we got what we were looking for. And this is the vision. The vision of influence the system from the outside in starts with knowledge in a meaningful way, and that becomes powerful. And if we could do it as a group, as a community, we could really make a change for the better. Some of the disadvantages is I mentioned about judging the accuracy of the information and finding the information through all the clutter. And that was kind of what this webinar is about, is step one, start collecting your own information. Even if you're healthy and there's no conditions, start collecting your information, start building that longitudinal profile, because one day it could come in handy. And then once you have the information, you're in a better position to judge the accuracy of the information you find online. And also you can declutter the volume because there's so much information and it's doubling so quickly that sifting through that is hard. And that wraps up the webinar. The plan for the next webinar is about using the community for the decision-making process and what you could find online to help you make healthcare decisions, especially when it comes to chronic disease. We welcome more insights into what you like to hear, different webinar topics, just from the experience of the team. Utkarsh, his background is he's done the research in behavioral health, but also he has a background, he's an MD as well. And so we have quite a few caregivers, patients, as well as professionals on our team here to kind of share our experience, and that's what we want to do.